joining us from. My name is Amy Savage, and I'm a technical officer in the Climate Change and Health Unit here in WHO headquarters in Geneva. And I'm really pleased to welcome you to our first technical webinar in the technical webinar series that we're conducting over the coming months, covering a range of climate change and health topics. So today we'll be looking at how to get started with your climate change and health vulnerability and adaptation assessment. Before we start, just a little bit of housekeeping. So you probably noticed we have two sessions for each webinar. We have a morning session, Geneva time, that we already conducted this morning, and then we have this session now. For this one and all the coming webinars, the two sessions are the same. They cover the same content, so no need to attend both of them. And I'm just sharing here quickly the schedule, which you've probably already seen. These are our upcoming webinars. The QR code leads to the schedule. You'll see that next week, the next webinar is looking at how to access adaptation fund financing for climate change and health, specifically with WHO as an accredited implementing entity. And if there are any topics, any specific topics that you're really interested in that you don't see in this schedule, please do contact us and let us know, and we can see if we can add a webinar in the future. So today we do have simultaneous interpretation in French and Spanish this afternoon. So if you would like to use the interpretation, you can set that up now. There's some instructions here on the slide. And we've set up this event as a meeting rather than a Zoom webinar, but there are quite a lot of us here today. So I do ask if you can remember to mute yourself when you're not speaking. And of course, make use of the Q&A and the chat function, and we'll try and respond to your questions during the session, or if not, we'll follow up as needed. I would also like to note that we are recording the plenary sessions. We won't record the breakout sessions, and then we will put those recordings on the WHO website so that those who weren't able to make it can watch the recording. So you'll see here our agenda for this afternoon. In a moment, we'll hear from Dr. Diarmuid Campbell-Landrum, who is the unit head of the Climate Change and Health Unit here at WHO headquarters. I'll then hand over to my colleague, Dr. Carlos Corvalán, who will present the main content of this session on getting started for conducting a climate change and health vulnerability and adaptation assessment. We'll then get to hear from Dr. John Bosco from Uganda about the experience of planning the VNA in Uganda. After that, we'll have the opportunity to break into smaller groups so that we can discuss and share experiences and what we've just heard from the presentations. Finally, we'll then come back to plenary. We'll have an opportunity to feed back and hear from the other groups what they discussed, and then we'll summarize and close the session. So I'm now pleased to hand over to Dr. Diarmuid Campbell-Landrum. Thank you.
Thanks so much, Amy. It's a real pleasure just to say a couple of words just to open this webinar. And the first is just the level of importance that WHO now places on the issue of climate change and health. Obviously, everybody who's joined this meeting thinks it's important, but WHO has now elevated this in our next 5-year program of work to be the first of only 6 strategic priorities that WHO is promoting within our own work and with promoting as a public health agenda for the world as a whole. So you can see the level of importance that we and global public health now gives to this issue. And I'm really pleased that this is a webinar series, and as Amy said, it's actually set up as a meeting, which I think is quite right, because WHO has been working on this issue for a very long period of time. We've built up a very large body of technical resources over, in fact, decades now. We've tested them in pilot projects, and that's the content that we'll be trying to get across, and that you've seen in that very nice program that Amy has just laid out. But we know that this is an ongoing action, and it's one that needs to be grounded in country reality. So it's really important for us, that meeting aspect of these webinars, these meetings, to hear from the participants, to have you working together, to hear from experts, as we heard from Indonesia in the last session, we'll hear from Uganda today, because we are in the business of building a community of practice that will support this work going forward. The last couple of things I'd like to say is that I think it's very appropriate that we're starting off with vulnerability and adaptation assessments. Our first immediate priority is to protect people's health from the wide range of impacts that climate change is already bringing. To do that, we first have to understand the issue. We need to understand the vulnerabilities, to understand what our options are for adaptation. And that's where we're starting today before getting on to the other program about what we can do about it. And again, we very much look forward to your input in your discussion. The final thing, my final job is to hand over to my colleague, Carlos Covalan, who is one of the longest standing global experts on climate change and health, worked for WHO, worked supporting many countries, developing much of our technical resources. The last time I did this in the last session, when I was so nice about him, his computer stopped working, and I think it got modest. Hopefully, both Carlos and his computer will not be modest this time, and I can hand over the word to Carlos. So over to you, Carlos.
Thank you very much, dear Mita. Good morning, good afternoon, good evening, everyone. I'm gonna present a little bit on the VNA, the process, but we're going to be focusing very much on the first of 6 steps. So let me just share my screen and make sure that you are seeing the right screen and not the other notes. Am I in the right place?
We can see the presenter slides.
Okay, so let's move this around.
Yep,
how about
that's
now?
Perfect.
Perfect. Okay, so let me get started then. So basically, what we are going to do is to tell you a little bit about this guidance that you can scan there and download. And this guidance, many of you have seen the Vulnerability and Adaptation Assessment Guidance from 2013. And this is an updated version we did in 2021. And I think that you're going to find that it is very similar, those of you who had worked with the previous one, but has been updated considerably. So please have a look at what we're going to present so that later we can discuss. And let me continue here. So basically, we're going to be doing what is marked here in light blue. Of the many things that we can do in this guidance, we're going to be specifically talking about framing and scoping the VNA according to their context. Of course, there will be other training, and in the other training, you will go all the way to applying the 6 steps of the VNA. So you have hopefully have seen before the operational framework for climate resilient health systems, which was published in 2015. Late last year, we published an updated version, which expands on the previous guidance, but as well, it includes other elements specifically related to low carbon health systems. So it is quite an interesting guidance to look at. You have the link there. And one of the 10 components of this guidance has to do with vulnerability and adaptation assessment. And the aim is to assess the current and future variability to the health risks of climate change and the policies, programs, and capacity for health systems that could help us to increase resilience. This is something to explain to you what do we mean by vulnerability factors. And this is a very extreme photograph that you have in there, but it's something that we see in some countries of the world. And it's useful for us to explain how people may live with several vulnerability factors simultaneously. So starting from the top right, biological factors, in a community like this one, we may experience populations that are undernourished. We may experience population with high infectious disease burden. There may be pregnant and breastfeeding women. If we think of demographic factors, we think of age, and this population may have a lot of young children that are vulnerable, or there may be some population dynamics, like, for example, people that migrated here because they had no other place to live, or they were forcibly sent away from another place. When you think of geographical factors, what we observe here are examples of an unplanned urban housing. It's probably a flood risk zone. It's probably a food insecure zone. When we think of socioeconomic factors, we're definitely seeing poverty, an unsafe informal occupation, unsafe water and sanitation, and inadequate shelter. And finally, speaking of socio-political factors, we would probably find discriminated minorities, people without information, people without a voice. So all these things may be overlapping in the same communities, in the same people. And then on top of that, we have climate change, which often are forces that make all this significantly worse. So when we want to do vulnerability and adaptation assessment, we have to understand a few things. First of all, that not all of them are done in the same way. We've seen people doing things very differently. We've heard examples of people adapting the VNA, and that's fine. But these are more or less the guidance that we would like to see, and include things like having a participatory process. We don't want this to be run by one group without the participation of many stakeholders. We want to understand that there are different goals, timeframes, different resources, and therefore things can be done very differently in one place to another. People may choose a different time period. You may try to link to health planning of 5 to 10 years. You may want to go longer, to say 30 years. It should include a range of stakeholders. We don't want this to be run just as an academic exercise or a Ministry of Health exercise alone. We want this to be as participative as possible, and definitely having the key stakeholders, which includes the affected communities, participating. You may have a big budget or a very small budget, but you can still work with the budget that you have. And you may have different approaches regarding how you collect and analyze data, and could be that if you don't have a lot of data, you may do qualitative assessment or a quantitative assessment if you have more data, or ideally using both. So this is to show you the 6 steps of a VNA assessment. So we will focus today on step 1, but of course we will be seeing along the sessions that follow from this webinar other presentations that will focus in other parts of these 6 steps. But just to go very quickly over the steps, in this one, we're going to do planning the assessment, framing the scope, where, what are we going to be doing. In the second step is the actual vulnerability assessment, in which we would be looking at the current risks, for example. In the third step, capacity assessment, we would be looking at what is the current capacity, how can we improve on this. In the fourth step, we would be looking at the future, and for sometimes you can do very detailed modeling of the future, or very scenario building ideas on what the situation will be in your area. In step 5, you will do the actual adaptation assessment, in which you start looking at your policies and see how this work that you're finding will be fitting in the policies. And then at the end, we will do an overall synthesis, which will give decision makers, as well as the affected communities, a good vision on what is next, what needs to be done. And we say that this is an iterative process because we can repeat this in different ways. If you start small because you only have the budget to look at one risk factor or one health outcome, you can do that and eventually extend it to make it more comprehensive. So the focus then now is going to be on step 1, planning the assessment. So let me go very quickly through this now, and then we're going to go in detail in each one of them. So in step 1, we are establishing the project team. We have preparing the management plan. We identify representatives from other departments within the Ministry of Health or other ministries, etc. In step B, we identify the key questions that we want to address with this assessment, and that will depend, of course, on the needs of the country, the amount of funding that we have, the available stakeholders, etc. In step C, we want to define the risks, outcomes, the geographical region that we're going to be covering, the time period we're going to be covering, and overall, what would be the focus based on this of the assessment. In step D, we establish the stakeholder process, including as many people as is relevant to have, but we always mention that we should include the communities, the populations that are affected by climate change. In step E, we identify data, information, and documents, etc., that will help us to understand the area of concern, the problem of concern. And finally, we need to develop a communication plan which we'll be using throughout the assessment to inform from communities all the way to decision makers, making this a very transparent process. So let's start with the first step. So we have the lead organization identified. So the lead organization ideally will be the Ministry of Health. The Ministry of Health doesn't have to actually do the whole work. They could delegate the work to an academic institution or another group, but it is important that either they do the assessment or they ask another group to do the assessment, but they are in control of the assessment. So that is extremely important because they will need to develop a management plan that would include the timeline, the roles of each one, responsibilities. They will have to allocate a budget for this work. They will also define the scope of the project. They will identify the goals and what experts they will need to have in a particular team. Core team, project team will be established, and these are going to be the few persons that are going to run with the assessment over the time period and all the 6 steps, but they will also be using additional expertise by bringing in experts in a larger group, expert that will help us answer specific questions. Specific questions they may have about specific topics. For example, you may need a meteorologist to help you with meteorological data. You may need an epidemiologist, a biostatistician, an entomologist if you're concerned about your work is about vector-borne diseases, etc. In step 2, or B, step B, we're going to see how we set goals. We need to set goals, understanding the priorities, human and financial resources that we have available, and we will look at, or the Ministry of Health will look at its own priorities. We would establish mechanisms to collaborate with stakeholders, of course, identify the human and financial resources, the capacity levels, the strategic goals that we want to achieve. And then we would have identified a set of questions. For example, depending on what we want to do, we would say, okay, we are not able to do the whole country in this assessment, but what regions or what populations are most vulnerable so we can focus on them? What would be the current distribution of climate-sensitive health outcomes? Which other factors determine vulnerability in these communities, etc. So we also have in step 1C, the health risks, the outcomes, the geographical region, and the time period that would be the focus of the assessment. So in this case, for example, regarding health risks, we would want to see what is the expertise that we need in the project team given the health risks or the health outcomes that we're having. So if you're having malaria, you will think we need an entomologist. If you're having if it's a heat health issue, you will want to have persons that understand about cardiovascular diseases, etc. So that would help you to link the health risk with the health outcome and identify the key persons that you need to involve. When you think of the geographical region, you would say, well, we have funding to do the whole country. The country is got several geographical regions, subnational regions, and we can do them all. Or no, we are only able to do one province, or for a long period of time, for a short period of time. So this will depend on your budget, on your availability of resources in general. When you think about the time period, you would need to decide, I mentioned this before, do you want to link this with a health plan that may be 5-year plan, 10-year plan, or you want to go further into the future and need to assess, say, 30 years or so. So many ways to do this. It's not one formula that will tell you exactly. It depends on your needs and your resources. So, of course, there are other factors that affect vulnerability. So if you're thinking of 30-year time period in a rapidly developing economy, we know that many of these vulnerabilities will change over time. If you have an area that is receiving or losing people due to migration, these are very rapid, important changes. So all this needs to be included in the assessment. When we look at step 1D, in which we establish the stakeholder process, so what we want to see here is that we want to engage representatives from all groups. And groups include non-governmental organizations, universities, the populations affected. You can think of many groups that will be needed to be identified. We don't want to leave anyone outside the scope of the work. They're all needed. So stakeholder representation could include, for example, health programs, organization institutions knowledgeable about climate change and development, for example, not necessarily climate change and health, but climate change and something else, development in this case. Policymakers, which would be national level, subnational level, or depending on what the geographical scope of your assessment. And fourthly, communities and vulnerable groups that will be affected by climate change and by the policies that could come out of this work. In this step, what we want to do is identify all the information and data that will help you inform the assessment. So, for example, we would very immediately tend to go to peer review literature. So we're making an assessment about malaria in a given geographical region and vulnerable groups in that region, etc. We would go through the peer review literature, but there will be also a lot of information hidden in smaller documents, in gray literature that we want to find out from universities, NGOs, international organizations that write reports. They could be extremely useful. And also community reports, someone that has done studies in the culture of the communities that we're concerned about, etc. When it comes to data, we need definitely health data, which the Ministry of Health should have. They may have to put it together based on different departments that hold different data sets, but that's very feasible to collect. Climate data sometimes is easy to collect, sometimes not so easy, because some agencies will want to sell their data. So this needs to be negotiated in memorandum of understanding with the different groups that hold data. And of course, as we said before, vulnerability factor data. So what are the levels of population exposures, factors, the sensitivity, their coping capacity, etc. At the end of this, we will have a communication plan. So as we said before, this communication plan will help give credibility to the work that we're doing. We will use all formats possible. Some examples there, infographics, presentations, podcasts, newsletters, social media, etc. So we want to target everyone in this communication plan, and we definitely want participation from all stakeholders, the affected communities, to also be recording what they are learning, what they are finding out. So we want to use the plan throughout the 6 steps, sharing results as they emerge, engaging all stakeholders, and I said already, this will give credibility and legitimacy to the project because we are informing everyone. Having completed these 6 initial steps, we have completed step 1, and you're going to see that the exercises that we're going to be doing will touch very much upon this step 1 and some of the things that you heard now. You will be able to summarize it in your discussions now. So I'll pass over to Amy, and thank you.
Thanks so much, Carlos. That was super interesting. And now we get to hear about how it is being put into practice. So I'm pleased to introduce Dr. John Bosco from the Makerere University in Kampala, Uganda. John, please go ahead. And if Carlos, you just stop sharing your screen. Perfect.
Thank you, Amy, and thank you, Carlos, for that introduction. I hope you can hear me clearly.
Yes, we can. Thanks, John.
Okay, so just a moment as it switches to presentation mode. So first, I would like to appreciate the opportunity for having to share the work we are doing here in Uganda, and that is leading to really building resilience in climate and health, and to appreciate the Rockefeller Foundation for supporting this effort and the rest of the team here that's been part of this. So we started around September last year to roll out to do a national vulnerability assessment in preparation for developing a national health climate adaptation plan, or the HNAP, which will feed into national efforts to build resilience in the health sector and the other sectors. And I'll be sharing a bit of what we did and the lessons learned according to what Carlos has shared. Sometimes not exactly, but we have to adapt to the context and the prevailing conditions. So in the selection of the districts or the geographical location of where we did the assessment, we had to put in consideration the climate-related extreme events that have hit the country historically, and these were available from the Prime Minister's office, that is really the custodian for disasters, and of course other partners like the Uganda Red Cross. So we got information on landslides, on drought, on floods, on storms. The tools that were provided by WHO, of course, were broad, looking at global, so they would talk of sea level rise, but we don't have a sea in Uganda, so we had to customize some of these to what applies. And then we also had to review existing data on the health outcomes, and particularly, like you can see, there are landslides, so we expected injuries and mortality. And then we had lots of waterborne diseases, non-communicable diseases, respiratory ill health, and malnutrition, and foodborne diseases, zoonosis. As you know, that we have, we are close to lots of national parks, and we have this high risk of spillovers of zoonotic viral or viral hemorrhagics and others. And of course, the vector-borne diseases, malaria, dengue, filariasis, and others, and then mental health and psychosocial health. So we try to distribute these across the country to inform the selection of the districts. So both the hazards, climate-related hazards, and the health outcomes that I just explained here. In terms of the team composition, Carlos also talked about what team do you really consider when you're setting out to do a VAA. So you're trying to basically marry environmental factors with the public health factors, and you need to understand also the causal chain that leads to the health outcomes that you see. So you end up becoming diverse in your selection of the team. So we needed to have public health specialists that understand disease causation and how the environment, the environment actually influences what we see in the health. And of course, this is best done by the environmental health team. So we had to bring on board the environmental health team. And then we had medical doctors, we had health and policy systems experts, because this was going to be a policy document that needed to sail through the approvals and eventually to be adopted in the national implementation frameworks. We needed a health economist to really create a business case for investment for different partners, and also to compute the costs for the different actions that were to be proposed in the HNAP. We needed a health geographer to show the picture of what really happens where, and how does really geography moderate health outcomes and vice versa. And the hydrometeorologist to sort of forecast and interpret the data that is available. If you're talking of wind speed, what does that mean for air pollution? If you're talking of floods, what kind of floods? And then the other key stakeholders that I must mention here. the environmental health department was very supportive. And it is the custodian actually for climate change and health studies at the Ministry of Health or Actions. It's the one that is coordinating partners that are coming in the health space. And then Makerere University School of Public Health, that's my home, has been really at the forefront and the grant holder from Rockefeller to advance this work and actually to do a very rigorous study that can be published that has gone through the robust systems here, including IRB and the WHO. The WHO provides a guiding framework, so many tools on how to do what, and also linking us to the broad network. Another important thing that we had to consider is bringing on board the actors, the people, the institutions that are involved in doing different bits and pieces of actions, the government, the academia, particularly the government actors looking at, for example, the Ministry of Finance is the one that holds the climate finance in Uganda, and it is the designated focal point. And then the Ministry of Water that hosts the climate change department, and then the other line ministries, departments, and agencies, the local government, we have to make sure all those are involved. And then implementing partners or funders, including UNICEF, USAID. I have not mentioned everybody here, but all those are part of the loop. And when we are sharing this information, that communication plan also involves sharing the right information with the right partners. Now, the other players that are critical are the non-state actors, the CSOs, civil society organizations, and NGOs, both local and national. And these had to be very much involved from the start because they fund different pieces of this process. For example, Regenerate Africa has very much interest in climate and health, same as AMREF. Seed Global is coordinating a lot of things on the continent. Clinton Health Action Initiative and others as listed here. So these were participating in the workshops that we held, right from the beginning, conceptualizing where the scope, and then the bigger stakeholder workshops that we held to validate the findings of the VAA and also to co-design the HNAP. And we have said along with these stakeholders, some of them are actually participating in approvals, even within the Ministry of Health, because they are members of technical working groups. The type of data and then the data sources and the challenges that we experienced along the way and how we overcame. I want to start with primary data, which we picked from the districts, in fact, 43 districts across the country, and particularly in 726 health facilities. So this we did both quantitative and qualitative, and we were looking at vulnerability to several climate-related hazards, such as floods, storms, the rising water levels, drought, heat waves, and others, like I mentioned earlier, and how these affect the building blocks of the health system. That is the health workforce, energy, water sanitation and hygiene, and waste management, infrastructure, technology, and products and processes that make health service delivery a reality. The challenges that we faced. In some cases, it would be difficult to access some areas, some directly because of the hazards like floods. In some regions, we could not reach the areas we wanted to reach, or sometimes it is just the bad roads or difficulty in accessibility, hard to reach areas. And then the heavy routine or workload for the staff, that it would limit the time they would portion for us to participate in the study. And therefore, our research team had to wait much longer to get the right people who have the information. And so it calls for a lot of patience. Sometimes the time that you budget for, you may not be able to achieve everything in that time that you have budgeted. And then, like you can see, there are many hazards and many outcomes and many components that they may affect. So you sort of need to triangulate each with how it is affected. So that made the tool so long. And yet we felt this was the time to pick all this data. So we had to endure the length of the tools and pick all the data and make sure that we clean it up. So we are very proud of the data set that we have, and we think a lot that it will come out of it. How we overcame these challenges, we tried to, as much as possible, to do prior mobilization of participants so that they sort of set off time for us when we go to the field, we're able to meet them. Also, most of the time, we decided to first invite them to a central place, the district health office, and have engagement with them at the district health office and do the tools, because many of the tools were based on their feedback. And for specific cases that really needed visiting, then we went and visited the sites and did observations, see how this climate was actually affecting the health facility. Then also, because the tool was quite long, we tried to interview them in groups. If they are coming from the same health facility, and sometimes you find there are issues of the time when the incident happened or the climate event happened and the time the health worker was there. So we needed to capture, triangulate information so that we get the right information, and also to avoid fatigue. So we tried to group them in groups of 2 to 3 per health facility so that they could respond to the questionnaire. And then for secondary data sources, there is a lot of information out there, and it is very important to do a detailed review and pick this information and make good use of it. So for climate-related health outcomes, we looked at the DHIS2, which is available at the Ministry of Health. So we had to get access to that and pull out the health outcome of interest. And then from the Office of the Prime Minister, we are able to get the National Disaster Risk and Vulnerability Atlas. And then also we needed the climate risk country profile. For those countries that maybe you may not knowing where to get the climate risk country profile, but World Bank has done quite some work. It has a repository for many countries, so you could check it out, the climate change knowledge portal. It gives, including the national determined contribution for your country. It also gives information on the country risk profile and other documents that have been developed over time for your country. And then also we needed to get the locations of the health facilities and map these against the flood risk. So we picked the flood risk data from the Ministry of Water, and the Health Atlas provided the location information. Challenges for this secondary data: a lot of bureaucracy sometimes in accessing the data, because sometimes you find there are no data sharing agreements. And this is one of the things that we are addressing in the HNAP, to make sure that the HNAP will try to advocate for data sharing across align MDAs and partners. And then sometimes the data may not be up to date. So you find you have disasters only stopping up to 2019, yet you have disasters that carried on all the way like 2020 and 2022. So and then incompleteness. Information is there, but it has lots of gaps. And it also may not be for everywhere. So how we try to overcome is to identify the gatekeepers and engage these gatekeepers, make them stakeholders and participate in each of the bits that we are working on, and then make use of the pre-existing collaborations, because already there are working groups that somehow talk about climate change, different meetings, conferences, partner engagements. So we tried to make use of these. Then also Carlos talked about communication plan. It's very important to have this communication plan, because we are at the point of, we are searching for information and generating information and sharing out information to critical stakeholders that need to take action. So you need to know who to tell what and when. So for the key stakeholders or implementing partners, that's between the Rockefeller, the School of Public Health, Ministry of Health, and the WHO country office, we had to do weekly meetings for update to know what is happening and what needs to be oiled somewhere to move. And the partners have really been supportive in that sense. And then frequent or weekly meetings with the team, the core team that was driving the process. And these, we had to divide out roles and responsibilities and make sure these are well coordinated. So I have had to make sure that that coordination is done effectively for us to pull out this work in a short time. And then the modes of communication included physical meetings, but also online meetings, posters, presentations. We have had poster presentation like recently we had in Spain at the Attach conference, and the presentations that we made at COP28. The publications that we are working on, because this reach that we have to certainly publish a lot out of it. The emails, WhatsApp groups to keep everyone on toes, and phones, etc. The lessons that we have learned and we think are useful for whoever is going to start the process. First, you need to do that in-depth literature review. Look at all the sources, secondary data sources. Sometimes you don't want to reinvent the wheel. Some of this data may be existing somewhere. It's just that you do not know. A lot of modeling has been done by other partners. Maybe the scale may vary, but you need to look out for what is existing. Then taking on a mixed methods approach will yield complementary information that is useful for the HNAP. A lot of what you pick on the ground, including information from the affected communities, because when you go to the health facility, you will certainly need to interact with the community that are being served by that health facility. So you would need to do some qualitative interviews and focus group discussions with the community to get to know what really matters when it comes to climate change and health in their context. And then obtaining ethical approval. This is currently there isn't much published evidence, especially in our local context here, about climate and health. And we need that evidence. And you can't get it out there into peer-reviewed, reputable journals without ethical clearance. So this is sort of an appeal to the rest of the teams that are going to conduct VAA to take an extra mile and get ethical clearance to improve the credibility, access, and utilization of the findings. And then engaging a broad range of stakeholders, right from government, NGOs, UN agencies, CSOs. It fosters collaboration and ensures consideration of wider perspectives. You get people from reproductive health and people from mental health, people from environmental conservation and others all coming to converge on how they can safeguard the environment to promote the health and well-being. And lastly, I just want to talk about what would be helpful for other countries that are going to do VAA. Where do you start from? How do you assess where you stand? And what do you really need to do? Consider who should you involve? So when you're developing the VAA or the vulnerability and adaptation assessment proposal, you need to bear in mind that it will feed into the HNAP. And sometimes if you are going to do these two independently, they may not overlap very well. So a good idea would be to develop one proposal. And if you're lucky to get a partner that will support the two components at once, the better. So consider the time frame it will take you for the VAA and HNAP and be sure of the time. At first, we thought we would get this done in 6 months, but we have done everything to have the VAA ready. But the HNAP has several layers of approval because it's going to be a Ministry of Health document adopted by government. It needs to be approved, and you cannot control the timing of those approvals. So we've had to present so far 3 technical working groups, and we're still going for more 3. So you have to bear that in mind, and also the cost. And then ensure that you have enough funds, either from government or from development partners, or if you can even attract the private sector to support this. Identify the right consultant. It was already talked about. You could, the Ministry of Health is the lead, but it does not have to be the one to conduct the study. You may want to take on either an academic institution or another consultant that has the experience to do the job. But the MOH should, the Ministry of Health should take keen interest in every step, right from the proposal development to field work, support supervision, consultative workshops, and mobilizing these stakeholders, because sometimes the consultant may not be as convincing or well grounded with the different partners as the ministry is, and should also review the different drafts to make sure that its interests are actually addressed. Then ensure that all state and non-state actors that are relevant to climate and health are involved in the process. This will create ownership and will guarantee their support. And then ensure that all the processes are aligned with national development frameworks. Yes, so I think this is all that we wanted to share from our end in these few minutes. We will take any comments from your side. Thank you.
Thanks so much, John. That was really interesting, and I really enjoyed seeing Carlos's presentation and then how that was put into action in Uganda. Particularly, thank you for being so open about the challenges and then how you overcame them and the lessons learned. I think many of these will be common to many people and relevant for others just starting out on their journey. If you could just stop sharing your screen, I'm going to put up a slide. We now have the opportunity to break out into smaller groups and to start thinking about how we can apply this to our own context. So just a moment as I share the slide. So we have 4 breakout rooms and of different aspects of the process. You can select whichever room you would like to be in. However, the interpretation is only working in the main room. It doesn't work in Zoom in the breakout rooms. So if you need the interpretation, or if you're interested in the topic on stakeholders and communication plans, please stay here in the main room and don't select a breakout room. The other breakout rooms that we'll have one looking at project team and stakeholders. Then we'll have a room looking at the aims of the VNA or the research questions that we might like to cover in that. And then the final breakout room, we'll be looking at the scope of the VNA, which different health risks we might cover, or different climate hazards, the geographical scope. So if you do have any issues joining a breakout room, I have a colleague here who'll be able to help you out. So just type into the chat. Otherwise, my colleague Christina will open the breakout room, select the one that you're interested in, and we'll have an opportunity to discuss a little bit more in smaller groups.
So, perfect. So, yeah, we're going to start with your team, Olena. So thank you everyone for your participation. I hope you all managed to use the Jamboard, or at least go through the questions and verbally to complete the task. So we're going to start reporting back. We have about 3 minutes per person because we're running a tiny bit late. So the first group is stayed in the main room, the stakeholders and communication plan. Olena, is anyone reporting, or is it you?
So I can summarize a little bit, and then we had one participant also who shared a very nice experience who can maybe contribute as well.
As long as it's 3 minutes.
Yeah.
We're really short of time. I'm a bit worried about the time and
Yeah,
people to leave.
Thank you. Okay, so very quickly, which we discussed which stakeholders would be good to include in the process and how they might be included. So there were many ideas of different ministries that should be included to really have an intersectoral approach. And then local governments and local administrations in specific areas that might be more affected by climate change that are being involved as well. And really, people have been emphasizing that it would be important to have a detailed stakeholder analysis as part of the VNA process as well, and also being able to identify some civil society organizations, some specific experts in academia and research centers, and even some specific groups in the population and religious groups as well in some countries that can play a very important role. And we also discussed how these stakeholders can be included. So different approaches that would be tailored to the particular stakeholders, whether it's consultation meetings, stakeholder forums, focus group discussions, different workshops as well. Yeah, so that was most of the discussion turned around this. And perhaps I will actually pass it over to you now for the interest of time. Thank you very much to all participants that have contributed.
Okay, thanks, Olena. So this was very useful. I can see that you managed to have a good discussion. Let's go to the second group, which is the one that was looking at the project team and stakeholders. And Antonis, did anyone ready to report from your group?
Yes, thank you, Carlos. Dr. Spirit.
Yes, and I'll go very quickly for the sake of time. In our team, we looked at who those core team members would need to be, and we also felt like the ministries of everybody needs to be a part of that, from health, finance, gender, etc. We looked at specific experts that would need to be a part of this, as well as modelers and some of the citizens who are directly related to the issues of study. As it related to challenges and recommendations, we looked at the awareness of health professionals, how many health professionals are even aware of the intersectionality between the issues being studied and how these issues and determinants of health affect the individuals. We talked about the limited funding in support of most of the initiatives. If you don't have funding, then you oftentimes can't get very far at all. We looked at the challenge as it relates to the lack of integrated communication systems, as well as deficiencies in technology and infrastructure, whether that is technological infrastructure or that is actual roads and highway infrastructure. If we can't get to one another and we can't connect and we can't share information, those are definitely challenges to the work. We looked at geological and climate issues, the issues around risk management and security, and also some of those global challenges related to food insecurity. As it relates to recommendations, we talked about the need for creating linked platforms and integrated data platforms for that data sharing. And we looked at other stakeholders that we may need to consider, and those included private sectors, recognizing marginalized groups who are typically left out of the contributions. We looked at the educational sectors, youth organizations, religious organizations, and we know that all of these individuals can also be included through research and involving them in the research.
Wow, that's amazing how you managed to cover all that in 15 minutes. So that was extremely interesting.
We covered a lot of ground.
You cover a lot of ground. So I'm very glad to see how this exercise is really very useful and shows how feasible it is to do this if you put a bit of time and head to it. So let's go quickly to the other group that was looking at the aims and questions of the VNA and the policy context. Terry, you were going to report on this one, please.
Okay, thank you very much, Carlos. We had quite a few participants and they contributed many thoughts and ideas to this. Starting with the objectives of the vulnerability assessment, it was suggested an objective should be to determine whether the climate change hazards impact health outcomes directly or they impact indirectly through affecting the delivery of health services, although in many cases it may be both. Many people said an objective of the vulnerability assessment should be to assess particular impacts or impacts in particular areas. For example, are there impacts on mental health? Are there impacts on food systems and nutrition? Impacts on vector-borne diseases? Even it was mentioned impacts on sexual and reproductive health. And it was suggested that really we need to look at the broad range of impacts, and an important objective of the vulnerability assessment should be to prioritize these, because resources may not be sufficient to tackle everything. So we would want to know from a public health viewpoint, what are the most important ones to prioritize. It was also suggested that the VA assessment should look at the impacts on waste management. And that made me wonder, should it also look at other determinants of health? For example, impacts on water supply and sanitation. Of course, I think one of the basic ones is there's an objective to determine the vulnerability for different populations and also for different locations where the populations are located. Among the research questions, several were suggested. What factors determine vulnerability or risk? Which regions of populations are most vulnerable? Well, Carlos gave us those. Other research questions are, what are the existing measures in place in the community to strengthen resilience? And also in the healthcare system, what's the capacity of the healthcare system to adapt to risk? Someone suggested one important question is, how does the vulnerability differ between rural communities and urban communities? And then an important question is the economic assessment. What are the costs in economic terms if we do nothing, and what are the benefits, if we put measures in place to reduce vulnerability? We identified several challenges, although we ran out of time to discuss how to tackle or how to overcome these challenges. But lack of policy framework was mentioned. It was mentioned that there may be lack of understanding about the issues among some of the stakeholders, and there may be resistance to change among the stakeholders, which could be for a variety of reasons. Data availability could be a challenge, either in the case where data is insufficient or there are obstacles to accessing that data. And insufficient technical expertise was also mentioned as a challenge. As I said, we ran out of time to address those. But that's what we came up with in our group, and that's what I wanted to share with you. Thank you.
Thanks a lot, Terry. I think very useful. I'm going to go immediately to Amy on defining the health and geographical scope and data sources, because we're definitely out of time now. Amy, please go ahead, whoever is going to present from your group.
Yes, we have Charles presenting. Thanks, Carlos.
No.
Yeah, thanks, Carlos. Thank you, Amy. Quickly, our group looked at the scope and the areas that that came up in terms of the health risks that these VAAs should be focused on. There was a lot on health-related heat stress, infectious diseases, non-communicable diseases. And in terms of the hazards of interest, of course, heat stress was a top of the agenda. There was a lot of mention of floods, which, of course, we've already seen in lots of places. And in terms of the factors that would influence the scope that the VAA should take, there was a lot of discussion on financing, the policymakers and their interest in this area, lack of sufficient guidance. But of course, WHO is providing a lot of that, and also sometimes political stability in some places where instability is prominent. It may hinder the scope of the VAA. We also briefly touched on geographical zones or the geographical scope that it should take. And there was an idea around focusing on climate hotspots. So for instance, in Uganda, we have hotspots for landslides, hotspots for flooding. So focusing on such hotspots so that we really get data or information from the most vulnerable populations. In terms of data sources, there was a mention, I think what I've not had in previous VAA presentations, the private sector. So to also include private sector in a data source, but of course the more mainstream data sources also came out, the DHIS2 from Ministries of Health, a disaster history of the country, hospital records, and also satellite data, which is becoming more and more prominent in the age of AI. And finally, we looked at the challenges for data access and also data quality, and the fact that in a lot of places, this data is not complete. So that is something to keep in mind. And maybe lastly, there was a contribution on the population of interest, whether the population or the VAA, the scope of the VAA should start from the population that we are interested in. For example, maternal and child health populations. Thank you.
Thank you very much. I think we're ready to move quickly to summarizing the session. I'm not going to speak very long because we're late, but just to say that from my point of view, the session was really, really useful. What I presented was all the technical aspects that you can find in the guidance. And if you haven't downloaded it, I really encourage you to download it and to look at it if you want to involve in a team that is planning to do a VNA. As you know, it's a very recent guidance, so it's possible that many of you have seen an older version of it, not this one. I think that John Bosco did a fantastic job for me because he put what I explained in theory, he put it into practice in the situation, the analysis that they did in Uganda. And you notice that they selected some regions, they look at a variety of risk factors and a few health outcomes, and they included a large range of stakeholders with a lot of expertise. So they did exactly what we wished to do in a VNA. And they did something that was interesting because he mentioned in one part that they did an analysis also of health facilities. And health facilities is going to be another webinar that we're planning to do. I believe it's on the 10th of July. So keep an eye on all the webinars because the other ones that follow will be related to VNA, but also on other topics. So having said that, I think that thank you very much. The groups really understood what we wanted to do. And I think that you also got a feel that this is not too difficult. Look at what you managed to do in 15 minutes. Imagine if we had several weeks to plan this properly. Thanks. Over to you, Amy.
Thanks so much, Carlos. I'll be super quick because we are running a little bit late.
Sí, porque no se ve nada.
I just wanted to quickly touch again, we've already mentioned a couple of times that this is a series. And the thing that I want to emphasize is if there are any topics that are not in the schedule, like I mentioned at the beginning, please do let us know if there's something you would like us to cover. I know there were a few things that came up in my breakout room that would be really interesting to cover in another webinar. And I will finish the session with a Slido. So you can use the QR code or you can go to slido.com and put in WHOCCH as the code. And what we want to ask you here is, what are your key takeaways from the session? Have you learned anything new? Is there anything that you'll take away and then use in your VNA process, or any action that you'll take away and start to use to get started in conducting your vulnerability and adaptation assessment? So we'll leave the Slido open for a few more minutes because I know we're already out of time. So the next webinar, just to remind you, is next week. We'll be looking at how to access climate finance from the Adaptation Fund for Climate Change and Health projects, and particularly with WHO as the implementing entity. And we look forward to seeing you all again soon. And I really wanted to thank you for your attention and your engagement, and have a great rest of the day, rest of the evening. Thank you very much.